There's a long history of trying to reform the American healthcare system. But after President Truman's failure to get healthcare reform passed in 1948 and 1949, there was not much attention given to healthcare. But it came back on the agenda for several important reasons. First, healthcare costs were rising as doctors could do more and people could go to the hospital more frequently. Second, most people were getting their healthcare coverage through their employer because of World War II and because Congress had passed a law that said that employer provision of healthcare would not be taxed as income or on the payroll taxes. But there were groups left out of the employer-sponsored insurance program, particularly the elderly. And because healthcare costs were going up and the elderly used a lot of healthcare services, many of them were in poverty because of the healthcare costs. So in 1957, a representative from Rhode Island introduced a bill called Medicare to allow the elderly to get health insurance through the Social Security system. After Medicare was originally introduced in 1957, not much happened, but interest in solving the problem, especially of the elderly, grew. And healthcare was a major issue in the 1960 presidential election pitting John Kennedy versus Richard Nixon. Both parties agreed that something had to be done, but they had different proposals. John Kennedy supported the original Medicare bill that would provide coverage to the elderly through Social Security. Richard Nixon went back to his bill, allowing people to buy private insurance with subsidies from the federal government through a voluntary program. When John Kennedy won the presidential election, not much happened on Medicare. He could not get his bill through Congress. John Kennedy is assassinated in 1963, and healthcare reform had not been enacted. When Lyndon Johnson became president, he pushed to complete President Kennedy's agenda. He constantly called on Congress to complete and pass all of President Kennedy's legislation, including healthcare. But nothing happened until President Johnson won a major landslide victory with over 60% of the vote in the 1964 election. And then immediately when the new Congress came into session, Representative Wilbur Mills began crafting Medicare and Medicaid. The first part of Medicare, covering hospitals, was modeled on the original Democratic bill. The second part, covering physicians, was modeled on the Republican proposal that there be insurance individuals pay for that covers physician services. And coverage to the poor, Medicaid, adopted an old program that was a jointly administered state and federal program. The bill engendered a lot of controversy, and Republicans, and in particular Ronald Reagan, opposed it. He made a record arguing why we shouldn't adopt Medicare and Medicaid. One of the traditional methods of imposing statism or socialism on people has been by way of medicine, he argued. It's very easy to disguise a medical program as a humanitarian project. Most people are a little reluctant to oppose anything that suggests medical care for people who possibly can't afford it. But we do not want socialized medicine, he concluded. The American Medical Association was launching a very large campaign also against Medicare and Medicaid. Johnson used all his techniques and all his skill as a legislator to persuade people to pass the bill. And here we can hear Johnson talking to people about Medicare and Medicaid.
Remember this, 9 out of 10 things that I get in trouble on is because they lay around. And tell the Speaker and Wilbur to please get a rule just the moment they can.
They want to bring it up next week, Mr.
Yeah,
President.
but you just tell them not to let it lay around. Do that. They want to, but they might not. Then that gets the doctors organized. Then they get the others organized. And I've damn near killed my education bill letting it lay around.
Yeah.
It stinks. It's just like a dead cat on the door. When a committee reports it, you better either bury that cat or get it some life in it.
The Speaker is saying to me, he says he's way ahead of you, Mr. President. He's going to get that on the House calendar next week and get it going.
But by July 1965, he was able to sign the Medicare and Medicaid bills in Independence, Missouri, with Harry Truman at his side. Lyndon Johnson developed a few rules about passing legislation. The 6 are: you need speed, keep the economists quiet, master the congressional process to make sure you can get out of committee, give Congress the credit so that they feel invested in it, go public and build momentum, and most of all, have passion and really support it. Johnson was able to use all those rules to get major legislation passed in his first year in Congress. He got the Civil Rights Act passed. He got a higher education bill where the federal government supported education. He got an immigration bill as well as Medicare and Medicaid, and those formed the core of his Great Society programs. For all their greatness, Medicare and Medicaid did not solve the health care problem. They were not universal health care coverage. And this led to almost immediate calls to fill in the gaps. Next, we're going to look at Richard Nixon and additional efforts to solve the problem of access to health insurance.